I would like to invite the final keynote presenter of the day, Dr. Claudia Arias, to join me on the stage. She's representing, I believe, both Berkeley University and InkSpace Imaging, so we look forward to your presentation.
Thank you. I'll use this one. Okay. Thank you very much for the invitation and the opportunity to speak here today. As mentioned, I'm representing two institutions, the University of California in Berkeley, where I'm a professor at the Electrical Engineering Department, and InkSpace Imaging, which is a company that I co-found with some of my colleagues from Berkeley. So, because I know that not many people are familiar with MRI in the printed electronics community, I will explain how I got here, and I will give you some background on the application itself and the requirements for both printing and the materials. And then I'll finally show you how we build a business case for this product. So my group does work on flexible electronics for many areas. We have worked on MRI, which is what I'm going to show you today. This part of it will be my talk. But we have also worked on biopotential type of electrodes that we integrated with machine learning and conventional electronics to show that we could monitor movements from the arm, and just by monitoring muscle activity, as well as the health of the skin, especially for patients that are laying in bed. We also worked a lot to develop blood oximetry arrays that are based on printed light-emitting diodes and printed photodiodes. And with this array, we developed a way of calculating blood oximetry such that we could detect not only pulse oxygenation, but also tissue oxygenation. But as I said, today I'm going to talk about something that is commercial today. All of these devices have gone into medical or clinical studies. Okay, MRI. Why do we care about MRI? MRI is the only imaging technique that does not involve radiation. So when you are sick, you definitely don't want to be exposed to more radiation. So the way that you as a person or as a patient should advocate for yourself is to ask for an MRI. But MRI has problems, and I'll tell you some of them. But it gives you very good contrast, and as I said, no radiation. How did I get to this? It all started about almost 13 years ago when I joined the University of Berkeley after leaving Xerox PARC. And I gave my first talk 2 weeks into my job. I gave a talk about printed electronics, which is more what we are used to in this community. And a colleague of mine came running behind me and said, "Oh, Anna, do you think you can print coils?" And I said, "What are coils?" I had no idea what coils were for MRI. So the coils are antennas that are put on top of the body of the patient as you are going into the scanner. So the scanner is what gives you the magnetic field that is going to flip the spins on the water molecules of the body. And the coils are RF antennas. So there are two types of fields, the magnetic field and the RF field in MRI. And this RF will give information about the location of where you are picking up the signal from the MRI. Okay, typically these coils are used for body imaging, also for head imaging. And most people that